Welcome to the EAU podcast series, Voices of Tomorrow's Urologists, journeying through Europe's resident perspectives. In this episode, we are joined by Dr. Hevia Palacios, urologist and kidney transplant surgeon in Ramon y Cajal Hospital in Madrid, Spain, and Dr. Alessio Pecoraro, a final-year resident doctor in kidney transplant department of Careggi University Hospital in Florence, Italy. Together, they will discuss residents' role in kidney transplants. Join us as we embark on this informative journey.
Hello, everybody, and welcome to this EAU podcast, which belongs to the Voices of Tomorrow's Urologists inside the ESRU, and journeying through Europe's residents' perspectives. And today's episode will be about inside the operating room and the role of the residents in kidney transplant surgery. My name is Hevia, and today will be my pleasure to share this podcast with Alessio Pecoraro. He has a promising career as urologist and researcher with several papers published about kidney transplant. Welcome, Alessio.
Thank you very much. Thank you very much, Vital. And it's an honor for me to be here with you. My name is Alessio Pecoraro. I'm a final year resident at the University of Florence under the mentorship of Professor Sedni.
Okay, so if you agree, we can start since the very beginning of the kidney transplant surgery, which probably the first step is the donor surgery. We have several types of donor surgeries. A big part is the deceased donor with a donor in the brain death or the non-heart beating donors. And I would like to know from you, from a resident perspective, the role of a resident as a first assistant or second assistant, or even in this non-heart beating donor, the deceased donor, the multivisceral or isolated kidney retrieval. Which is your role and which is your experience in this setting?
Thank you very much for your question. My personal experience is based on three different experiences. The first one was during my medical school. I performed fellowship at the Royal London Hospital, the transplant unit department. And the second one in Florence during my residency, and the third one in Barcelona at Fundació Puigverd under the mentorship of Dr. Territo and Dr. Breda. I think that in my personal experience, the residents should be involved in kidney harvesting procedures, especially in disease donor setting, because it's a great school and a great opportunity to learn anatomy, to see specific surgical field, and to gain a lot of surgical skills in open surgery. Until now, I performed about 20 procedures as a lead surgeon in the DBD setting and DCD setting using ECMO, mainly in Florence and in Barcelona. Super quick technique is not used in Florence, but I was involved in Barcelona because for control DCD is very useful and it's used in Spain, in Barcelona.
Yeah, so I guess you inside the non-heart beating donor, you always use the ECMO machine to retrieve the kidneys and not the super quick technique.
Exactly. Yeah.
Okay.
That's our strategy because in Italy we have a strange, weird legal framework with a long no-touch period, about 20 minutes, instead of 5 minutes like in Spain or in UK. So to maintain the perfusion of the organs, of the abdominal organs, usually the donors are maintained in ECMO.
Okay. So your opinion is that role of residents in this part of surgery, which is the kidney retrieval, even in a multivisceral or the isolated kidney retrieval, allows to have a good knowledge of retroperitoneal anatomy and give us surgical skills to even for oncological surgery, or what is your thought?
I think that it is a great opportunity to improve your surgical skills in open surgery, even for oncological interventions. And it's a great opportunity to move hands in surgical fields that are very challenging and weird for the urologist, like the intraperitoneum space and the cannulation of the aorta, the cannulation of the IVC, and also the bench surgery to learn how to manage and how to handle the vessels.
And moving to another setting, which has some similarities, but it is quite different, which is the living donor. What is the role of a resident like you in a very important department as Florence in this surgery, the living donor nephrectomy? You do it lab, you do it robot, you do as a first assistant, you do parts. What is your experience?
First of all, it's important to know that living donor nephrectomy is a challenging procedure due to the stress it places on surgeons operating on healthy individuals. It's a particular setting, and it's a fascinating setting, I would say. In Florence, we usually perform a robot-assisted living donor nephrectomy. We don't use the laparoscopic approach, and all the procedures are carried out by an experienced surgeon that is the chair of our department, Professor Sedni. I usually assist Professor Sedni as a first assistant during the procedure. And when I was in Barcelona, I used to assist Dr. Terito, that is the main surgeon for living donor nephrectomy. And it was very nice because I was able to learn and to have some tip and tricks also for the pure laparoscopic approach in this procedure.
So in Florence, you do it robotically, and when you do it robotically, your role is as a first assistant not in the console, but beside the patient?
Yeah, bedside assistant.
When you're becoming a senior resident, do you participate in some parts of surgery?
No, because it's
very challenging.
Quite challenging because we have a low volume if compared to Spain, to a lot of Spanish centers. We usually perform like 11 cases per year until now. So the experience and the particular setting of living donors prevent to be involved residents as first surgeon. That is the main reason.
And knowing the heterogeneity of Europe and other countries, what is your opinion about the surgeon of the living donor nephrectomy? Do you think that surgeon must be familiarized with transplant surgery, or might be oncological surgeon with experience in nephrectomy, for example? Do you have an opinion? I know it might be delicate, but what is your opinion?
From my point of view, a surgeon that is the main responsible for living donor nephrectomy must be involved in kidney transplantation, because once again, it's a particular procedure. It's an easy procedure because it's an healthy patient, but I think it's a stressful situation where you have to be very focused on specific tasks, and you should have a great experience to deal with the scenario beyond the surgical procedure.
So we totally agree. I have the similar thought. So moving to the next step, we have the kidney retrieved, even from a living donor or from a deceased donor, and comes the bench surgery part, which sometimes is missed. The importance of this step sometimes is less than expected and comes with some surprises, particularly in the deceased donor. Which is the role of a resident in this part, according to your experience?
First of all, bench surgery is a crucial stage in kidney transplantation that requires specialized surgical skills, particularly in vascular reconstruction. And as a resident, I was involved several times in bench surgery. Usually, I performed the procedure as first assistant, but sometimes I performed it as the lead surgeon. And I think it's very nice because you can learn how to deal with vascular problems like hole in the vein. So you can learn how to put the stitch properly on the vessels. And I think for residents, even not interested in kidney transplantation, it's extremely important to know how to deal with these aspects of surgery, because it could happen during a surgery for oncological reason to deal with an hole in a vessel or to put a stitch on a vessel.
So it's like a part when the start of the tailoring of the kidney according to the recipient and coming from the donor starts, and sometimes needs some crucial maneuvers, some crucial reconstructions to tailor that kidney to the recipient who is going to receive it a few hours after.
Exactly. So the experience is crucial, I think, because in my experience, bench surgery should be carried out by the transplant surgeon in order to prepare the kidney and the graft properly for the kidney transplant, and in order to not have a surprise during the kidney transplantation.
Okay, and the machine perfusion, I know you in Florence have experience with machine perfusion, which is a part of the bench surgery and the period between the donor and the recipient. Did you receive any education in the process of the connecting that kidney to the machine perfusion? Do you have experience with them? Which is the role of a resident in your institution there?
Okay. In Florence, machine perfusion is typically used for organs from donors after cardiocirculatory death. And during these procedures, senior residents usually prepare the machine, while residents, under the guidance of senior surgeons, place the organs in the machine. The training process for connecting the kidney to machine perfusion is overseen by senior residents and the staff members. And in addition to this in-house training, there are some specific training sessions that are organized by industry professionals to train residents and staff members to connect the kidney to the machine. So it is a task that usually is performed by a junior staff member or senior residents in our hospital.
So after finishing the retrieval, finishing the bench surgery and the preparation of the kidney, comes the exciting part of the transplant process, which is the kidney transplant surgery. As a resident, do you perform or do you have an important role in this surgery during your residency training? Is it different from the very beginning when you're a young resident than when you become a senior resident? What is your role in the vascular anastomosis of the urinary reconstruction? And finally, which is your role, if you have it, in the robot-assisted kidney transplant?
Regarding open kidney transplantation, residents in Florence are usually involved as first assistant. During the first years of residency, the residents are involved mainly in specific steps, easier steps of kidney transplantation, and then there is a growth of the involvement. Regarding specific steps, during my fellowship in Barcelona, I have the opportunity, thanks to Angelo Territo and Dr. Breda, to perform all the steps of open kidney transplantation, from the incision to vascular anastomosis. And in Florence, residents are mainly involved in ureteral anastomosis. Vascular anastomosis are mainly performed by staff members, considering the potential consequences of technical errors during vascular anastomosis. Regarding robot-assisted kidney transplantation is a particular field because in Florence we have a huge volume if you compare to other centers in Europe and in the USA, but the overall amount of cases per year is quite low, about 15-20 cases per year. And robot-assisted kidney transplantation is a particular procedure where the surgeon, the lead surgeon, has to have specific skills in robotic surgery and in open kidney transplantation. So it's important to create a specific pathway, a specific training pathway to build a good surgeon able to perform a robot-assisted kidney transplantation. This is the main reasons why on the Supujvert and in Florence, robot-assisted kidney transplantation is usually performed by one specific highly experienced surgeon, and also because robot-assisted kidney transplantation are usually performed from living donors. So it's extremely challenging and stressful.
So probably it happens with a robot-assisted technique for this surgery, a similar thing that happens in different surgeries. For instance, oncological surgeries. That is the role of the residents in robot-assisted surgery is a different role rather than laparoscopic or open surgeries. I guess that your role as a resident in the open surgery of kidney transplant is a very active, is a role as a first assistant in many cases, as at my institution. But in robotic surgery, your role is assisting as a second or being in the OR to help whatever might happen.
Exactly.
Great. My institution has a typical tradition that when the resident comes to his fifth year, the final year of residency, we try to help or assist him or her to a total kidney transplant surgery, even vascular anastomosis. But they start doing the vascular anastomosis when they come to the fourth year of residency. And during the second and third year, they help a little bit during the urinary reconstruction. But the vascular anastomosis in the final years, and when they finish their residency, they usually do a total kidney transplant from the skin to skin, from the very beginning to the end.
That's very nice. Very nice. There is a training pathway.
Yeah. And now there are several tools, new tools, very emerging and pushing tools in residence educational programs, mainly the 3D printed models. Ricardo Campi, your colleague, and your institution have a big experience with the printed model for the robot-assisted kidney transplant, or even in the open kidney transplant. Other programs and suggestions to this topic. What is your thought about the role of these tools might have in the near future, even now at present, in our educational programs and our training programs?
I think that dry lab should have a big role nowadays for surgical training. And in this scenario, 3D printed model may be used by residents or junior staff members to learn specific surgical steps and to perform these surgical steps safely. So I think that in this scenario, our model that was designed by Dr. Campi and collaboration with medics, the rack box, may be very useful for residents in order to train and to simulate the vascular anastomosis during open and robot-assisted kidney transplantation in order to train properly and to learn from errors. So that I think it's a good way to learn and compare your skills with other residents and with other colleagues.
So for robot assisted or for open surgery, I agree with you that dry lab and models are very useful for us for training in the very beginning, and not only in the very beginning of the procedure, to know our skills and to get used to the process of suturing and moving our hands and moving all the instruments to properly create a good anastomosis and the good movements before going to the human and operate the human. I have the same thought as you, and I'm happy to share it with you.
Yeah, I think it's a good opportunity that we have, and we can improve our outcomes, our surgical outcomes on patients after a properly training on ex vivo model or 3D models.
And finally, what do you think our potential opportunities for research and networking and collaboration between colleagues among Europe doing kidney transplant? You have been an excellent researcher during these years. I guess you might have an opinion about the potential role of residents in research related to kidney transplant. What is your thought?
I think that kidney transplantation is a good field where you can carry out international projects in order to improve the current evidence on specific topics. And I started this pathway when I was at medical school. I performed several projects on kidney transplantation. this field could provide several opportunities for networking, for fellowship, for job positions in the future. So I think that beyond the surgical skills and specific love for kidney transplantation or interest for kidney transplantation, I think that this field could provide opportunities for residents, even from a scientific point of view. For example, as you know, the YAO Kidney Transplantation Working Group is a very active group with several young residents and staff members that are enjoying the pathway together and to improve the current evidence in this challenging field. So I would suggest to consider at least a career in kidney transplantation or to be involved during the residency in kidney transplantation, considering the potential benefits in terms of surgical skills and the research, networking, and fellowship opportunities.
Okay, great. So your message would be that people younger than 40 years, even older, but particularly younger than 40 years, interested in kidney transplant, both research and clinical aspects of kidney transplant, try to do the application to this very active group. So share knowledge, thoughts, and projects with experienced people very dedicated to this field. So we've come to an end. Thank you, Alessio. Thank you very much for sharing your thoughts. We really appreciate and we hope you have enjoyed this podcast and that it could be useful for you, your knowledge, and your education. Thank you very much to all of you.
Thank you very much. Bye-bye.
Bye.
Thank you for this insightful episode. We are sure our listeners enjoyed it. To keep up with the latest EAU podcasts and stay informed on urological advancements, be sure to subscribe to our EAU podcast channel on your favorite podcast app. Until next time, keep learning and stay inspired.